I'm here to talk to you about lower back pain. There's a couple of reasons why. The first one is because it's so common. Common, like 4 million Australians at any given time have lower back pain, A. And B, 7.5% of the globe has lower back pain. That was enough to make 2021 the global year of lower back pain. It is so common. That's number one. That's the first reason why I'm bringing you this video. The second reason I'm bringing you this video is because there's so many poor narratives or outdated narratives around the explanation of back pain, around what to do about back pain, and the reason I know that is because we keep seeing it coming into the clinic. People coming to us talking about things like, I've got a slipped disc, my back's out of whack, and so on and so forth. There's just so many different ways that people present their narrative about what's happening with their back right now. And it's just really important to start clearing it up. So I'm going to bring you four different things that are good to look out for, and just good to know if you're not sure what's going on with your back right now. Number one, and number two, what are some things that you can do right now about your back pain? That's really important. So the first one is that your pain levels have nothing to do with the severity of the problem. So how much pain you're in, I understand is the more pain, it almost seems intuitive that the more pain equals a bigger problem. But we've got to understand that pain is a signal or an experience that's generated inside the brain. And that might be, for someone that hasn't heard that before, that might be a bit weird or counterintuitive. It's like, yeah, but the pain is actually in my back. Yes, there is pain in your back. You are experiencing the pain in your back right now, but the signal is being interpreted and experienced in your brain through the circuitry of your nerves. And if you're really fearful or frustrated or agitated or upset, or it was a really big traumatic experience, then the pain signals that could be generated inside the brain could be amplified because of what you've also experienced in and around the problem, not just the signals coming from the lower back itself. So the signals that are coming from the lower back itself then get sent through to the brain, and the brain, it's up to us to contextualize it, to put meaning to it, to put emotions to it, and then to also correlate that with our previous experiences, and then the experiences of those that we've seen before or heard of before that have gone through similar episodes of back pain. All of these factors either amplify or de-escalate pain. So if you've got pain right now in your lower back and it's really severe, understand that may not always correlate to a severe problem. So that's really important to know. And it also highlights the importance of seeking professional help. Seeking professional help is a crucial part of, firstly, understanding what is going on right now and making sense of your experience, number one. Number two, having advice that's right for you, that's going to help you make the right decisions along the way so that you can have the tools you need to recover from the problem as well. Okay, that's number one. Number two, movement. So pain in the lower back will either come from too much movement or too little movement. And more often than not, it's because of too little movement. And by little movement, what I mean by that is you're not moving the lower back in the ways that you need to, as often as you need to, in order to reconnect that part of the spine with your brain in a safe and therapeutic, or a safe and controlled manner, so that your brain identifies that the lower back moves well, it works, and all systems are go. When there's no signal coming from the lower back, i.e. you're not moving it at all because you are sitting all day, and that part of your spine in the lower back there stays stagnant, then that stagnation starts to almost blur, or it starts to almost like a relationship. If you're not talking, then how do you know whether or not, what's your updated status? You don't know what the other person that you're communicating with, what they're up to. So your brain and your lower back need to communicate on a regular basis through movement, through nerve signals, in order for their relationship to stay sharp, crisp, and clear, so that then when you do move, then normal movements to you are signaled exactly as that, normal. But if the communication between the lower back and the spine is blurred or slowed or just non-existent, then you're more likely, the brain is going to then say, oh, that is a lot of communication from the lower back. Let's assess whether or not that's safe, not safe. So in the case that your brain identifies the movement as unsafe, then it's likely or common or typical for your brain for you to then have a pain experience. And if it's not a painful experience, then at the very least, it could be a signal that you're receiving going, oh, that feels a bit tight. Oh, that just grabbed a little bit. And in those scenarios, then you can be confident that the relationship between your brain and your lower back is just a bit blurred, and movement is a good way to not just address that and create a little bit of therapy, but also it's a good way for you to manage it going forward, and it's a good way for you to potentially prevent it as well. Okay, so that's number 2. Number 3 is gone are the days of things are out of whack. So at this point, nothing actually goes out of whack. Everything is still attached, everything is still in the same position, and nothing slips. Your discs don't slip, things aren't out of position. However, it may feel that way, and I appreciate that this may be your interpretation of the experience that you're having at any given time. So by no means would we make you feel bad about just stating what you feel, and that is, I feel like I'm out of whack. Cool. Just know that the visual that goes with that can also be quite escalating, thinking that being out of whack is necessarily bad. Now, why is that important? It's important because there's a whole range of different positions and postures and asymmetries that actually can't be linked. We haven't been able to link positions, postures with specific injuries and pain. So understanding that being out of whack or being a bit lopsided is actually part of being human. It's not necessarily a bad thing, and nor does it mean that you have a problem. It's more that if you feel out of whack, if you feel not normal, then what that's indicating to you is that the inputs, the sensation that you have on one side or one spot compared to another side or another spot, is now different to what you normally perceive, which could be an indication that the relationship or the communication between your brain and that spot is not the same as it was previously. And your brain, the meaning that we put to that is I feel out of whack, or the interpretation we put to that is I feel out of whack. But what's happening neuroscientifically is I am perceiving inputs from a particular spot in my lower back that isn't normal. It's not the same as what I normally perceive, and therefore I'm going to flag that as abnormal, and I'm going to interpret that as I feel out of whack. The way we improve that is by boosting the inputs that we normally get. That's what treatment does. That's what putting a ball in that spot does in the lower back that always gets tight. That's what stretching does. It boosts the inputs that we get from a particular area, and it just sharpens that relationship between the lower back and the brain again. Yeah. So gone are the days of being out of whack. Your practitioner should be sharp enough to be able to just coach you around that narrative, even though that's exactly how it feels. Know that that is exactly what's not happening. Nothing is out of whack. It just feels that way, and that is 100% okay. Understand that you are in one piece, and things just need to be sharpened up a little bit. So that's number 3. Number 4, we need to help you help yourself. So the whole part of this journey is about empowerment. Understanding that what you're going through right now is you're not helpless. There are lots and lots and lots of things that you can do right now to improve your health, your movement, your back pain, your mobility, and the management of the problem going forward. So if the last thing that we would do at Balance is to change or to make you feel that you need to keep coming back in order to manage the problem, that we have to be involved all the time. The purpose of healthcare is to give you the tools that you need to keep you moving and to keep your problem managed by yourself with minimal intervention. And that's part of duty of care and ethics. But the idea for us is to, yes, give you the tools, but to also help you remove the obstacles and to provide you with the right education that you need in order to use the tools appropriately. So if you were to come over to a Balance clinic in Sydney, one of our Balance clinics, we've got 4 clinics in Sydney, in Castle Hill, in Belrose, in Bondi Junction, and in Penrith. And if you were to see one of our team members, the whole purpose would be to remove the obstacles and then provide you with the education and the tools that you need to actually get on top of your problem. So that's no more rest, no more out of whack. It's not, you don't need to put ice on it. Nothing needs to be realigned. You are completely fine and strong the way that you are. We'd love to help you. My name's Nick Papastamatis. I'm the practice leader from Balance Health and Performance. Always feel free to reach out to us if you have a question, or comment below if you have questions, and we'll be here to answer them and to help you along your way as well. If you're still here, thanks for joining, and don't forget to subscribe to our channel.